Hi everyone, this is Meenakshi Ramesh. Today is day 4 of this December video series. Today I just want to share a study conducted by Dr. Dawson Church et al. About how EFT has helped, change the stress biochemistry. So I just want to I'm sitting in front of the computer and I just want to share a few points from the abstract. All of us know that cortisol is the major stress hormone. So when we get stressed, our cortisol levels go up, and when we are, in a calmer state of mind, when we are not under stress, our serotonin and dopamine levels are at a normal rate. Our serotonin and dopamine levels are better or boosted than having the stress hormone cortisol. So this study talks about how it was, the cortisol levels were reduced after just an 1 hour intervention of EFT. So the study examined the changes in cortisol levels and psychological distress symptoms of 83 non-clinical subjects receiving a single hour-long intervention. Subjects were randomly assigned either to an EFT group or a psychotherapy group receiving intervention, or there was also a no treatment group also. And I think many of you may be familiar, having a child on the spectrum. Cortisol is tested with a simple test, salivary test. So when you test your saliva, you can find out the level of cortisol, the amount of cortisol in the saliva, and that talks a lot about how stressed the individual is. So when they were tested after an hour of intervention, using EFT, the EFT group showed statistically significant improvements in anxiety, depression, and the overall severity of symptoms. So just wanted to share this study with all of you today because our ultimate goal is to have more serotonin and dopamine neurotransmitters in our nervous system and circulatory system, so that we have more of the feel-good chemicals in our body and not carry the stress hormone cortisol. Of course, not all stress is bad. There is eustress and distress. What is important is not to be in a state of distress, and eustress is okay, which all of us need to some extent, because it keeps us productive, it keeps us goal oriented, and it helps us to have the drive to do things. But definitely not distress. So just want to share the study, and you can look it up. You can just look up Dr. Dawson Church studies on EFT. There are several clinical trials done and published. So just wanted to share that, and that's all for today. I hope this will encourage all of you to do some tapping, maybe 5 minutes of tapping today. And I'll see you again tomorrow with another video. Bye for now.